A human being is always compared to a machine which works without rest to create ideas, express feelings, introduce thoughts. The input a human gets decides his intelligence rate. Thus, the sense of hearing plays a vital role in getting the inputs. When someone has the inability to hear as a normal person, it leads to hearing impairment. Hearing disability is one of the unique disabilities. This makes the inclusion power to get slower. Unlike other disabilities, hearing impairment primarily deals with language and communication. Hearing impairment should not be phrased as hearing handicap because impairment is the physical loss of an organ, like a hole in the eardrum. With normal hearing ability, people are aware of signals, they hear various sounds and languages, and they are also linked with other people by active communication. The above all are not experienced by a person who has hearing disability. When children with hearing impairment lose the support of their family, it turns into a handicap. Now, all nations are concerned with education for all. Since education is an important aspect of all human beings to achieve greater heights, all nations have a universal dream like education for all. So, special attention is paid to education, and the education system is relaxed and made more flexible. But the fact is that these children have greater ability to learn things faster. There are some modules which have theoretical, skill oriented lessons and experienced people's ideas that help to manage such people. Characteristics of hearing loss. No one can think of a life without hearing ability. It is an automatic process done along with several other activities. People with hearing loss do things in a different way. Since different people have different abilities, an important fact to be understood is every individual with hearing loss is different from the others because his functional levels may vary. One person with hearing impairment may manage verbal communication while another may not be able to do it. On the other hand, some may fluently read, write, or even speak. They have the ability to do things right, as a normal person does, but it depends on how things are done. The factors are hearing impairment by birth, caused due to aging, pre or postlingual acquired, affected in a single or in both the ears. It also has different modes of occurrences, which might be mild or severe. It can also be treated medically or surgically for cure, or sometimes cannot be treated at all. The occurrences may be temporary or permanent. It can accompany other disabilities also. If a child does not depend on the above factors, then there are other factors that impede their development. Their achievements may be determined by some other environmental factors to be checked, like if the child is being treated the right way, if the child has got access to hearing aids which make hearing possible, if the child is made familiar with sign languages for better communication, if the child is made to communicate at the early stage, if the child is being cared for by the family, if the hearing aid given suits them properly, and also whether the child is able to hear properly with that or not, if the child has got any neighbors or friends to communicate, which will in turn develop communication skills. If the child is being affected by other disabilities also, if the child is admitted in an appropriate school or not. When all the above environmental factors are being treated and checked, the child will develop or recover quickly from this hearing loss to compete with a normal person. These factors play a key role to determine the child's present and also the future of the child. When these factors fail to occur, more complex reactions take place so that the rate of curing of the hearing impaired children cannot take place universally. So these hearing losses occur only when the sensitivity to the sounds heard is diminished. Insensitivity to sound in the speech frequencies is normally termed as hearing impairment. So the people who detect a listener with a hearing loss must increase their volume so that the listener can detect it. Now let's listen to some of the causes of hearing loss. Hearing loss is the inability to hear. It may be total or partial. There are some diagnoses that help in determining hearing impairment, which is measured in decibels. Now, due to advancement in technology, nothing is impossible. Many get cured or prevent deterioration at least. There are many factors that cause hearing loss. The major causes are as follows. It may be genetic. Hearing loss can be hereditary. They can be inherited from your relatives. Genetically, these are of two different forms, syndrome and non-syndrome. Syndrome type is a case in which all medical problems occur along with the hearing loss genetically. But in non-syndrome type, only the hearing loss occurs without any other medical problem. Next is the noise. It is a reacting agent that causes hearing loss. Most of them are affected by noise, that is above the required decibels. People residing near airports have to face this risk in their day-to-day life. Flights landing and taking off create a huge noise of 65 to 75 decibels. When people are exposed continuously to that noise, their hearing sense is degenerated. Even crackers being fired at festivals and meetings create a huge decibel of noise. These may affect the aged people's eardrums easily. The next factor is the age. It is normal that increase in age causes hearing loss of high frequency sounds. It may be due to illness, continuous exposure to noise, and too much of toxins. These in turn react with the eardrum and make a hole which results in hearing loss. So sometimes they understand slowly. In some cases, when the speakers raise the tone, they tend to hear. Now let us look at the role of chemicals. There are also some specific drugs that cause hearing loss. When these drugs are taken without medical supervision, they cause adverse effects which damage the central auditory system and cause permanent hearing loss. It does not take place slowly like damage by noise, but react with high frequency to cause severe damage. Injuries. When people are injured severely on the head, then there is a change in the hearing ability. Most of the head injuries result in death, and in some cases, the ears will be injured, resulting in permanent or temporary hearing loss. Neurological factors. It is the disorder created by nerves. In this state, the sounds from outside are transmitted to the brain and understood. But a problem in this transmission causes the hearing disorder, so these sounds are not transmitted to the eardrum. Illness. Some of the illnesses cause hearing loss. Excessive alcoholic consumption and premature delivery may result in non-development of auditory nerves. Some diseases like mumps, measles damage the auditory nerves, which are the sense nerves. Most important is the fetal alcohol syndrome, which is more prevalent nowadays. If the mother consumes alcohol during pregnancy, the child may suffer from nutrition deficiency, causing hearing impairment or deafness. Now let's review the auditory system. It is the sensory sense that provides the sense of hearing. This system consists of the ear and the auditory nerves, which connect the brain and the ears. The ear consists of three parts. They are the external ear, the ear canal, and the pinna are present in it. It is the outer structure which is visible to us. The sound heard from outside just hits this pinna and normally gets reflected so that the brain recognizes the sound and identifies the direction of the sound transmitted. The transmitted sound gets into the tube, which is the auditory canal, and this canal checks the decibel of the sound and then amplifies it and sends it into the eardrum, that is the starting of the middle ear. Usually, the sounds are measured in decibels, and when greater decibels enter, it damages the eardrum. There are also small hairs present which prevent the dust from entering the ears. The middle ear. The middle ear is placed internally to the eardrum. It usually couples the sound transmitted by air through an oval window which is made by the principle of mechanical advantage. A footplate, commonly known as stapes, forms the vibratory portion of the eardrum. These stapes are a bone which are attached to the oval window. The sound collected enters the canal and hits the eardrum and is concentrated on this footplate. The force is increased and the velocity is being decreased, so they couple with acoustic energy. The middle ear can also control the noise transmitted to a certain level. It allows some contraction methods which result in reducing the decibel of noise transmitted. The middle ear muscles follow these contraction methods and help in preventing the damage of the eardrum. These middle ear muscles are ossicles. The ossicles consist of tiny bones which are given Latin names for their shape. They directly send the sound from the eardrum to the oval window. Next, we have the internal ear. It consists of the cochlea and also many non-auditory structures. The cochlea consists of three sections which are filled with fluid. These fluid waves are driven under pressure by the basilar membrane which separates the sections. One of the sections is the cochlear duct, which contains a fluid which is similar to the intracellular fluid in the cells. The other two sections are scala tympani and scala vestibule. They are in turn located on a bony membrane and filled with a fluid perilymph, which is similar to the cerebrospinal fluid. The composition of these two fluids is important for the functioning of the middle ear. Thus, the above information helps to describe the general outline of the ear functioning and their composition. Types of hearing loss. The auditory system ensures that the sound transmits from the external ear, enters the middle ear, and then goes to the inner ear. The brain receives the sound from the inner ear and the auditory nerves, and when this passage is being disturbed, it results in hearing loss. There are three classifications of hearing loss. The first one is conductive hearing loss. It is the state in which the sound waves are not properly conducted through the root. The root is defined as the conduction of sound from the external ear passing through the eardrum but not reaching the middle ear. This type of hearing loss may occur with other losses or they may occur solo. It also involves reduction in hearing sounds, that is, when small sounds are not heard. The speaker needs to speak louder so that the listener hears it. Here are some possible causes of hearing losses. Most commonly, these hearing losses occur due to earwax. Earwax is medically termed as cerumen, which is a yellow fluid, wax-like substance. It is secreted in the ear canal to protect the ear canal's skin. It also assists to clean and lubricate and also protects from insects, bacteria. When this is produced in excess, it in turn blocks the auditory canal and causes hearing disability. Another common problem is the ear infection. The skin of the ear canal is being affected by this. It is not a microbial infection but caused by active bacterial or fungal infection. In this type, the ear canal often swells and becomes tender and is painful. Sensory neural hearing loss. This type of hearing loss occurs when the inner ear is being damaged. This type of hearing loss results in abnormal functioning of the central auditory system in the brain, commonly called as central hearing impairment. So the sound may transmit back and forth on either side of the brain. Some of the causes. Mostly, this type of hearing loss is due to the poor functioning of hair cells. These hair cells may be damaged by birth or during the lifetime. It may also be caused due to the long exposure of noise. Noise refers to the greater decibel than the level which can be accommodated by normal ears. In this case, the person may be in a workplace with no hearing protection or listening through headphones with high volumes for a long period of time. Mixed hearing loss. This type of loss may be a combination of the two types mentioned earlier or with the sensory neural hearing loss. It may affect the eardrum or the middle ear or even damage both. In this case, if the ear is dry, air conduction aid can be tried. Now, what are some of the causes? This type of hearing loss is caused by ear infection, which in turn causes a defect in the eardrum. Mostly, it can be cured only with surgery, but surgery is not always successful. A sensory component is added and that will manage the conductive loss. Now, what could be the various degrees of hearing loss? Unlike the place of damage, the degree or the extent to which the damage has occurred needs to be found. A pure audiometric test is done to find the extent of hearing loss. Hearing impairment can be ranked as mild, moderate, severe, or profound. Now, what exactly is a mild hearing impairment? It is common for both adults and children. Normal adults can hear up to 25 decibels, and mild hearing loss occurs for children between 20 to 40 decibels, and for adults it is between 26 decibels and 40 decibels. What is a moderate hearing loss? It also has two types, moderate and moderately severe. It is between 41 and 54 decibels. On the other hand, moderately severe ranges between 55 and 70 decibels. Next comes a severe hearing impairment. Here, the decibel varies between 71 decibels and 90 decibels. What exactly is a profound hearing impairment? It is beyond 91 decibels. What is deafness? They do not tend to hear at all. Other descriptions for hearing loss are unilateral and bilateral. In the unilateral type, only one ear is affected and the other ear has the ability to hear. In the bilateral type, both the ears are being affected. Symmetrical and asymmetrical. In symmetrical, the degree of hearing loss is equal in both the ears. But in asymmetrical, the degree is not equal and in both the ears it may vary. Progressive hearing loss. In this type, hearing loss will increase over time. Sudden loss. It may occur suddenly, which may cause adverse effects and must be medically supervised quickly. Fluctuating hearing loss. In this type, the loss may fluctuate. It may be better for some time and worsen later and might be caused by a damage in the middle ear or an infection in it. Acquired hearing loss. This type is not by birth but lost in the intermediate state. When the loss occurs in the first 3 years of life, then it is prelingual hearing loss, since it is before the development of language. The later stage is known as postlingual loss. Next is congenital hearing loss. This type may occur by birth or it may be developed during pregnancy or even after birth. Hearing loss may have direct effect on the development of a child, so must be found in the earlier stage to be cured to improve the child's growth and development. Now, let's see what do we conclude from what we have learnt so far. It is found that in most of the hearing impairment cases, the deafness is preventable. Many preventive measures are there, like proper immunization and allowing low intensity voices and less noises into the ears. Some of the managing techniques are as follows. First, hearing aids. It amplifies the sound and increases the ability to hear, but it does not compare with normal hearing. But if we remove this, the problem will persist. Cochlear implants. It helps to improve hearing in one ear or in both the ears. It consists of an artificial nerve which helps to stimulate the pulse created and then converges it. It is very expensive, so it is not affordable by all. Wireless devices. It is a new invention to compete with wired devices. Here, the two components are present which send data to the listener and also collect data of the hearing impaired people. Assistive devices. It is generally used as an accompanying device which helps in illustrating the things. The mobile phones, video phones, and the processors come under this. The above help the hearing impaired people. First of all, these people must be treated well in the society without any partiality, and also the family must care more about them. If a child is affected, he or she must be cared for and then taken to a speech therapist, and other treatments should be done to reduce further loss. Nowadays, the governments have formulated new rules and examination procedures have also been relaxed for them so that they can also succeed. The schools must have a continuous practice to check their children academically and physically. We all know that prevention is better than cure. So rather than treatment, we must find preventive methodology. Since here we have gone through most of the causes and preventive methods, it should help us. Lesser exposure to noise and exerting less pressure into the ears will greatly help in this regard. And also, alcoholic consumption during pregnancy should be avoided, as it not only leads to hearing loss but also other serious effects. Many drugs are introduced which reduce ear damage and infections. So be aware and get rid of it at an early stage. If affected, go for a cure which can permanently solve the problem of hearing impairment.